The number of men with ED is expected to rise to 322 million soon. ED is a vascular or blood flow condition and an early warning sign of potential heart disease. The American Heart Association notes that twice as many men have heart attacks with ED. Not surprisingly, there's also a 192% increased risk of depression. ED and the number one killer, coronary artery disease, are the same underlying disease: clogged, inflamed, and crippled arteries. By age 10, atherosclerosis, hardening of the arteries, exists in virtually all children eating the standard American diet. No surprise that ED affects about 10% of men each decade of life. This means 40% of men in their 40s, 50% in their 50s, and 60% in their 60s, and so forth, will experience ED. Heart disease and ED are linked so closely that measuring blood flow in a man's penis can predict the results of a cardiac stress test with 80% accuracy. Our program addresses the underlying cause of most ED: stiff arteries unable to open wide, allowing blood to flow. PDE5 inhibitors like Viagra, Cialis, Levitra work by forcing open blood vessels, increasing blood flow to the penis. Unfortunately, even these drugs don't work in 40% of men, according to the Journal of Urology. Alternative standard medical treatments such as injections, vacuum devices, penile implants, and even penile prosthesis surgery are less attractive options for most men. A truckload of Viagra won't help your sex life after a stroke. So our program addresses the underlying cardiovascular risk in men today suffering with ED in natural ways, not involving potentially dangerous drugs or scalpels. A fundamental shift in healthcare is underway. There's a new focus on patient-centered healthcare. Why? When the focus is on you, better health outcomes are produced at lower cost. Above all, you want to be rid of the chronic condition. You don't have time for the culture of medicine to transform from doctor-centered to patient-centered. Writing another prescription won't prevent it. Scheduling a risky surgery won't reverse it. You want someone to show you exactly what to do, especially when you leave the clinic or hospital. Right now, you're left to figure it out on your own because the system is not focused on you, the patient. What we offer is different. We show you exactly what to do each day. Yes, daily. There's no guessing. There's no "we'll see you in 90 days. We're with you every day via text messages. Imagine if you were meeting each evening with your medical team to plan out the next day, to check in each morning, to have access to them from the palm of your hand, to help you make the best decisions, to keep you on track, to support you if you stumble. This is what we consider patient-centered now. This is how we move the needle on your condition together in 90 days. Your condition won't go away magically on its own. You can't wish it away. You must change very specific health behaviors. We help you figure that part out together.